Hello, welcome to Highlands Oncology Group. This video will give you information on what to expect while getting your chemotherapy treatments at Highlands. All the information in this video can be found in your new patient binder. We will start out this video by sharing a little more about Highlands Oncology. We have two clinic locations, one in Fayetteville and one in Rogers. Our clinics are open from 8 a.m. to 5 p.m. Monday through Friday, and the Fayetteville location is open from 8 to 12 on Saturdays. In the very beginning of your new patient binder, you'll find our general information page. This page will give you all the information you need regarding information for holiday closures, inclement weather policy, and how to reach physicians after hours and on weekends. On this slide, you can find the phone number for our clinics. It is very important that you keep this phone number. Our phone number for our clinics is 479-587-1700. Our phone number is very valuable to you because it is how we can assist you day and night. During our regular business hours, a triage nurse will answer your calls. If you call while the clinic is closed, an answering service will answer your call and contact the on-call nurse or the on-call doctor concerning any issue you have. There is always a nurse and doctor on call, so please do not hesitate to call us. You can also call us for medication refills, but please allow 24 hours for refills. If you need a controlled prescription refilled, please wait until normal business hours. The on-call doctor will not fill controlled prescriptions. We ask that you always call us before going to the emergency room. Because we are more familiar with your condition, we may be able to provide better care for you. However, if you're having a true medical emergency, such as signs of a heart attack, stroke, or difficulty breathing, please go to the emergency room. When you come into our clinic, you will usually go through a certain routine. You will check in, get labs drawn, get scans if needed, see your physician, then come to the treatment room for your treatment. Some days vary in which you do not see the doctor, or you do not get treatment, but the receptionist will always tell you where you need to be. Because our clinic offers so many services such as lab, scans, doctor visits, and treatment, it is very important for you to check in with a receptionist. Check in when you first walk in, check in after each step, such as after labs or after seeing the doctor. This allows us to keep track of you. We do not want you waiting in a waiting room without us knowing that you're there. Checking in with the receptionist allows us to make sure that you get served promptly. Treatment is given in a treatment room. A nurse will take you back to the treatment room whenever it is time for your treatment. When you come into the treatment room, you'll sit in a recliner and get your vitals taken. Your nurse will then get an IV started and give you pre-medications for your chemo that will help with any side effects. After the pre-medications, your nurse will start your chemo treatment. The length of the treatment varies depending on the treatment that you're getting. If you have any questions about the length of your treatment, do not hesitate to ask your nurse. There are only 2 rules inside the treatment room. We do not allow more than 1 visitor per patient. This is due to space constraints. Our second rule is that we do not allow children in the treatment room. Children under the age of 14 are not permitted inside the treatment room. This is for their safety. We do not want to risk exposing children to chemotherapy. While in the treatment room, we encourage you to bring snacks, books, laptops, anything to entertain yourself while receiving treatment. A friend or family member can sit with you while you're getting treatment to keep you company. We just ask that it is only 1 visitor. The treatment room has TVs, magazines, drinks, and some snacks available to you. We ask that before entering the treatment room that you check in with the receptionist. A nurse will bring you back to the treatment room. We will now discuss chemotherapy. There are many types of chemotherapy that our clinics give. Each chemotherapy is different and works with different types of cancers. The specific chemotherapy that you will be given will be explained by your physician and nurse. A basic explanation of how chemotherapy works is this. Cancer is caused by a cell mutation that causes the cell to replicate out of control. Chemotherapy works by attacking fast replicating cells and destroying them. Unfortunately, cancer cells are not the only cells in your body that replicate quickly. There are other healthy cells in your body that replicate quickly and are attacked by the chemotherapy. This can cause some of the side effects of chemotherapy. Now we'll go over common side effects of chemotherapy. First, we'll discuss bone marrow suppression. Bone marrow is spongy material inside your bones that produce all of your blood cells. It is responsible for producing your white blood cells, which are your infection fighters, your red blood cells, which deliver oxygen throughout your body, and your platelets, which help you clot. The bone marrow is rapidly producing these cells to support your body. When chemotherapy enters the body, it sees these replicating cells in the bone marrow as dangerous and begins to attack them. As blood cells naturally die off in your body, your bone marrow is unable to replace them, and we see a drop in your blood counts. We monitor your bone marrow suppression by reviewing your white blood count, your red blood count, and your platelets when you get lab work. We will go over this a bit more in the next few slides. When we look at your labs, we look at your white blood cell count and your absolute neutrophil count. These are abbreviated WBC and ANC. White blood cells are your infection fighters and are part of your immune system. Neutrophils are a type of white blood cell and are the most numerous of the white blood cells. Because of this, your ANC, which is your absolute neutrophil count, is a good indicator of your immune status. Chemotherapy often causes your white blood cell count to drop. This can cause you to be neutropenic. Neutropenia occurs when your white blood cell count drops and your body is not able to fight infections. When your white blood cell count is at its lowest point, it is called nadir. This often occurs about 10 to 14 days after your chemo treatment. During nadir, your ANC could be 0.5 to 1.0. When your ANC is this low, you are at severe risk for infection. This means that your body is not capable of fighting off illnesses. When your ANC is this low, we will often hold treatment. Your doctor may want you to get a shot called Zarzio. This shot stimulates your bone marrow to produce white blood cells. When your ANC is less than 1.0, it is very important for you to check your temperature daily. If it is 100.4 or greater, call us and make an appointment to be seen. If your ANC is low and you have any signs of illnesses, such as a new productive cough, unusual nausea, vomiting, diarrhea, or painful urination, please make an appointment to be seen. We do not want this to be ignored. While your ANC is low, you need to protect yourself from any type of infection. Hand hygiene is very important. Wash your hands often. Stay away from anyone who is sick or may be sick. Avoid large crowds if possible. Do not eat any raw meats such as sushi or rare meats. Thoroughly wash your fruits and vegetables before eating. If you have pets, do not clean up after them, as it may increase your risk of getting illnesses. If you have any questions or concerns, feel free to call the clinic. Before you start your chemotherapy treatment, we will give you a prescription for an antibiotic. Go ahead and get it filled. You will want this on hand just in case you start fevering or feeling ill while your ANC is low. Again, if you feel that you may be getting sick or have any questions, please do not hesitate to call us or schedule an appointment. Your red blood cells are responsible for carrying oxygen throughout your body. In your lab work, we look at a value called HGB. This stands for hemoglobin. Hemoglobin is a molecule on the red blood cell that is responsible for holding on to oxygen on the red blood cells. Its value tells us how well your body is receiving oxygen through the red blood cells. When this level starts to drop, you may feel tired, dizzy, or short of breath. This is because your body is not getting the level of oxygen it's used to. If your hemoglobin drops below 7.0, we often send you to get a blood transfusion at the hospital to help increase your red blood cells. Your platelets help you clot and stop bleeding. When your platelet level drops, your risk for bleeding increases. When your platelet levels drop below 75, we may hold treatment. If they drop below 10, we may send you to the hospital to get a platelet transfusion. When your platelets are low, it is important to remember that you are at an increased risk for bleeding. You may want to be cautious to avoid any heavy falls or accidents. If you do have a heavy fall or hit your head or have any other type of trauma, you should make an appointment to be seen. We may want to assess you for any internal bleeding or brain bleeds. When you are receiving chemotherapy, you do not want to take over-the-counter pain medications such as ibuprofen, aspirin, Aleve, Motrin, or Advil. These medications can thin your blood and increase your risk for bleeding further. We recommend that the only over-the-counter pain medication you take is Tylenol. If you notice any abnormal bleeding, such as a nosebleed that lasts for hours, blood in your urine, blood in your stool, or any unusual bleeding or bruising, please make an appointment to be seen. Other side effects of chemotherapy include hair and skin changes. Some chemotherapy can cause hair loss or hair thinning. This is because the cells that are responsible for creating hair are quickly dividing and are attacked by the chemotherapy. Hair loss occurs 2 weeks after the first chemo treatment. The hair will grow back, but it usually takes about 8 to 10 weeks after your last chemo treatment for the hair to grow back. The hair that grows back may be a different texture and color. If you experience hair loss, Highlands has multiple resources available to you for wigs or scarves. Your skin cells are another type of cell in your body that are quickly replicating and can be attacked by the chemotherapy. Your skin may be more sensitive while on chemotherapy. You want to be mindful when you go out into the sun. Make sure that you wear sun protective clothing and sunscreen. You want to be particularly mindful of the skin on your scalp, as it may be more sensitive to sun exposure. Keep good care of your skin and make sure that it is cleansed and moisturized. If you develop any rashes, please notify your doctor. Chemotherapy can cause side effects in your entire digestive tract. It is very important to keep your mouth clean and have good dental hygiene. First, let's start with the mouth. There are many blood vessels in your mouth, and it is a susceptible location for an infection to start. Mouth sores may develop with chemotherapy. This may make it difficult for you to keep your mouth clean. You may not tolerate commercial mouthwashes or strong toothpaste. You may want to consider using Sensodyne toothpaste and sensitive mouthwashes to keep your mouth clean. If you're having any mouth sores, let your doctor know. We can prescribe a mouthwash called Magic Mouthwash. Magic Mouthwash helps numb your mouth and can be swallowed every 4 to 6 hours to numb the back of your throat if needed. Other mouth issues that occur in patients may be taste changes. Some patients complain of a metallic taste in their mouth. This can be helped by using plastic silverware. Some patients state that they have difficulty tasting. This may affect appetite. It is very important to keep your nutritional intake up. You may just have to find whatever food works for you. Some patients struggle with dry mouth. Biotine is an over-the-counter mouthwash that may help with dry mouth. Before having any dental procedures done, you need to notify your oncologist and have them clear any procedure to be done. You will also want your dentist to know that you are getting treatment. Now we'll move down to your stomach and discuss nausea and vomiting side effects of chemotherapy. Unfortunately, many people struggle with nausea and vomiting while on chemotherapy. We try to make you as comfortable as possible. We will do this by providing medications before chemotherapy to prevent nausea, sending you home with nausea medicines, and giving you extra help if needed. Before you start your chemotherapy treatments, we will give you prescriptions for 2 nausea medicines, Zofran and Compazine. Zofran is also called ondansetron and is a pill that dissolves under your tongue and can be taken every 8 hours. Compazine is also called prochlorperazine and is a pill that you can take every 6 hours. You must wait 8 hours between every Zofran and 6 hours between every Compazine. However, if you take one nausea medicine and 45 minutes later you still feel nauseated, you can take another type of nausea medicine. For example, if you take a Zofran and you still feel nauseated after 45 minutes, you can go ahead and take a Compazine. If the medication that you have at home is not helping with your nausea, please let us know. We have other medications that we can use to relieve nausea. Before each chemotherapy infusion, we will give you pre-medications including nausea medicine. This should help provide relief for you during your treatment. If you have nausea during your treatment, let your nurse know and we will give you additional nausea medicine. We want you to be as comfortable as possible. Here are some tips for avoiding nausea that may help for you. Keeping a little bit of food on your stomach, such as crackers, can help avoid nausea. Eat frequent smaller meals instead of large meals. Avoid any foods that make you feel sick. Just eat what you can tolerate. Drink extra water to make sure that you stay hydrated. Eat ginger candy or drink ginger ale to help settle your stomach. You can also use distractions such as reading a book or watching a movie to overcome nausea. Chemotherapy can also cause decreased appetite. This plus nausea may mean that you are not getting the nutrition you need. We have nutrition classes available at each clinic that are free of charge, that are taught by a registered dietitian and can provide helpful information about how to keep your nutrition up while receiving treatment. The class is available at our Fayetteville location on the first and third Monday of every month from 11 to noon. It is also available at our Rogers Clinic the first and third Wednesday of every month from 1 to 2 p.m. To schedule, call the clinic and let them know you want to be scheduled for the monthly nutrition class, and they will set you up. It is important to call ahead and schedule so they know that you're coming. Moving down your digestive tract to your intestines. You may struggle with constipation or diarrhea while on your treatment. Constipation is often caused as a side effect due to pain medication or from your nausea medicine. In your new patient binder, you can turn to page 31 and you can find our protocol on constipation management. We usually recommend synacot over the counter for constipation relief. You can also use Miralax or stool softeners over the counter for constipation relief. You may not want to use X-Lax or any stimulant laxatives as it can cause painful cramping. If you have tried over-the-counter laxatives and still had not had any success with a bowel movement, go ahead and contact the clinic so you can get the help you need. Diarrhea is more often caused by chemotherapy irritating the intestinal mucosa. Our number one choice for alleviating diarrhea is over-the-counter Imodium AD. On page 33 in your binder, you will see instructions on how to take this medicine. You will take 2 caplets in the morning, 1 caplet after each loose stool, and 2 caplets at bedtime. Stop taking this medication if you have not had a bowel movement in 12 hours. If you find that you are taking 8 caplets a day or the Imodium is not helping your diarrhea, you want to come in to be seen. We may want to assess you for any infection of your digestive tract. We can also provide a stronger antidiarrheal if needed. If you're having diarrhea, it is important to keep your hydration up as you can become dehydrated very quickly. If you're having issues staying hydrated, you may want to come in to be seen and get some fluids. If you notice any changes in your stool, such as color change or blood in your stool, please let your doctor know. One of the most common side effects of chemotherapy is fatigue. You will feel drained after getting your treatment. Your body is going through a lot. It is important that you get the rest that you need. You may not feel fatigue until a few days after your treatment. This is often because we give steroids in the pre-medications. When they wear off, you may feel very fatigued. It is important to not give in to the fatigue. You want to stay active as much as you can tolerate. If you give in to the fatigue, it often makes the fatigue worse. You want to just stay lightly active. Walk around the house, walk around the block. Do something to keep you moving as much as you can tolerate. This often helps improve the fatigue. Listen to your body. If you need rest, take it easy. Only do what you can tolerate. Chemotherapy can affect your fertility. If you are of childbearing age, you may want to discuss fertility options available to you with your oncologist before receiving treatment. Chemotherapy may cause infertility or birth defects. Do not become pregnant or get your partner pregnant while on chemotherapy. This is a huge diagnosis and life change. You may experience anxiety or depression concerning your diagnosis. Please let us know if you're struggling with any mood changes so we can help you. We can refer you to support groups that are available, counselors, or provide medications if needed. If you're having any problems while on your chemotherapy treatment, please let us know. We do not know what you are struggling with unless you tell us. We want to make this experience as comfortable for you as possible. Now we'll discuss how to protect others from chemotherapy exposure. Chemotherapy is excreted from your body through bodily fluids. This includes sweat, tears, saliva, vomit, urine, and feces. Chemo is excreted through these bodily fluids for up to 48 hours after your last chemo treatment. It is important to protect others from chemotherapy exposure during these 48 hours. During these 48 hours, you want to be mindful of potential exposure to others. In the bathroom, you want to close the lid of the toilet and flush twice every time you use the bathroom. If you have any accidents and any bodily fluids get on your clothes, you want to make sure to wash those clothes separately from others' clothing. You want to avoid any sexual activity during this period. You do not want to share silverware with any other people for up to 48 hours after your last treatment. You can still be around others while being on chemotherapy. You do not have to be in quarantine during this time. It is just important to be mindful of how chemotherapy is excreted and to protect others from any type of exposure. We will talk a little bit about IV access for chemo treatment. Most people will get a normal IV in their arm. Some patients, due to their chemotherapy regimen, may get a port or PICC line. A port is an IV access site in your chest. It is placed in a quick outpatient procedure and provides a quick access point for lab draws and to give treatment through. The port is connected to a catheter that empties in a large blood vessel above your heart. A PICC line is another option. A PICC line is placed usually in your upper arm and is a long IV catheter that stays in place during your treatment. The catheter goes from your arm and empties in the large blood vessel above your heart. It will be covered by a dressing that will need to be changed every 7 days. If you have difficult veins and find that you're getting stuck multiple times each time you come in to get treatment, you may want to consider getting a port or PICC placed. If you are interested in getting these placed, let your doctor know. Always let your doctor know what medications you are taking. Some medications over the counter can interfere with chemotherapy. To ensure that you are getting the most benefit out of your chemotherapy, make sure to tell your doctor all the medications you are taking. This includes vitamins and herbal supplements. If you need any refills on your medications, call the clinic. Please allow 24 hours for refills to go through. Narcotics may only be filled during business hours. We have many services available to you at Highlands. We have social workers available who can help with financial aid and provide help through items like gas cards. We have spiritual care team that is available at the clinic if you would like to meet with them, along with several spiritual care volunteers. Hope Cancer Resources is a wonderful resource for patients going through chemotherapy. They can provide wigs and scarves for patients dealing with hair loss and can also provide rides for patients to and from appointments. They also offer many more resources for patients. These are wonderful resources and are available to all patients at Highlands. Navigating Care is available to you at Highlands. It is an online patient portal where you can access information, review some of your lab results, and prepare for your doctor's visits. For more information, ask the receptionist at your clinic. We also offer a helpful program called X-Pain. X-Pain is a system that allows you to tell your healthcare team how you feel when you're not in the clinic. It improves our ability to meet your needs while receiving treatment. At the end of your chemo class, your nurse will help you get signed up. Thank you so much for watching. We hope to make this experience for you as comfortable as possible. If you have any questions or concerns, please do not hesitate to ask.